greater extent at this early stage in this pandemic. So we are coordinating as much as daily with the local hospitals to understand what their needs are, and we'll continue to do so. So concerning rapid transit system, I'm here with Megan Gould from the Rapid Transit System. Previously, we have reported 2 drivers testing positive for COVID-19. One of those on May 16th, and the second one on May 24th. So today we are announcing that a 3rd rapid transit driver has tested positive. And so this is going to require some action on our part. First and foremost, Rapid Transit System will suspend service beginning this Saturday, May 30th, until June 15th. So that is a 2+ week period of time where there will be no public transportation system operating in Rapid City. So those relying on this service should be making those preparations over the next couple of days. Friday will be the last day this week. During that time, we'll have extensive cleaning and sanitizing that will be taking place on all the buses and in all the rapid transit buildings. Also during that 2-week period, all RTS drivers will be self-monitoring for symptoms. All of the buses will be evaluated for additional safety measures, such as physical barriers, and the drivers will be paid as a requirement of the CARES Act. And when service resumes on June 15th, there will be, the drivers will be better equipped with high-efficiency masks and perhaps protective shields, and any other safety measures or policies will be revealed prior to that time. So how did this happen? How does it happen that your bus drivers are coming down with COVID-19? Well, there's certainly no way to know for sure, but we do know that the drivers have had little or no contact with each other. So logic would state then that it's more likely they contracted the virus at home or at work from their contact with passengers of Rapid Transit System. So what's the plan now that our COVID-19 numbers are rising? There's a lot of anxiety. The anxiety rises as well. And we've had now months of preparation. We've talked about the peak for months. We've talked about what to do and how to behave and how to keep yourself and others safe. So now that we're really going upward, we're on our ascent to the peak, what should we do? I think it's very simple. We go back to the basics. We go back to everything we talked about in the very beginning with spacing between individuals, with face coverings. If you're not able to control the distance between other people or the crowd size, you should be wearing a face covering. And wash frequently. And you should practice protecting yourself. That is just the name of the plan that is going to get us through all of this, is just protect yourself. And it is not helpful to mask shame people in public who don't wear masks. It's not helpful to post pictures or names or business names or anything like that where someone wasn't wearing a mask. It's not helpful. It may make you feel better for the moment, but it doesn't help us. The whole point here is that you focus on protecting yourself. You cannot protect single-handedly the entire community or everyone else in your family. We have to rely on ourselves for that to a great extent. So if you're more vulnerable, if you're in the high-risk group, either due to age or pre-existing conditions or immune compromise, then you should be taking extra precautions, including up to staying home. I know it's been a rough few months with everyone doing their best to quarantine and then now wandering out because we're at this stage in the pandemic. But it's time now to reapply the basics, and that's the best we can do. The very best we can do for you right now is to just have you go back to those original 5 things that we talked about from the beginning, about spacing and not shaking hands and washing and covering your cough or sneeze. Just keep that up and I think we'll be okay. So as the numbers go on from here, we're going to be putting them in a localized chart so that we can see, also so that we can see the number of active versus recovered cases. And I have made a request of the Department of Health earlier today to work with us to find a way to release information about tourists when they're in the area. I think there's a bit of a problem with reporting that type of thing. I mean, philosophically, it seems like it's problematic to where do we report a visitor who lives in Arizona if he tests positive at one of our local hospitals. So I don't know if the Department of Health has contemplated that yet, but I made a request of them to help us work through that as well. There is a fear of tourism, and I assume a resulting fear of tourists when we see them. But in my opinion, seeing a car from Virginia or North Dakota or Texas presents no greater threat to you than a car from South Dakota, especially if you're practicing the basics and taking care of yourself. Our population will rise this summer with tourism. It always does. We have 5,000 hotel rooms in this town. I don't know if we're going to fill them this summer, but there will be out-of-state visitors here. I was sharply criticized for the last time when I said, we can't stop them from coming, so we may as well welcome them. And I was beaten up one side and down the other for having a cavalier attitude about tourists. And I suppose I would have made folks feel better if I would have used a different tone or a little less optimism when describing that. But the fact of the matter is this: we know the facts. We should go back to the facts whenever possible. No roads in South Dakota are going to be blocked to keep out-of-state people from coming here. That's just not going to happen. And as we see visitors, it will do no good to berate them, to be angry at them. They are here because they're tired of being at home. And I think many of us can relate to that. So whether you call it irresponsible or dangerous or whatever else, I think we just have to understand the facts are we are a place people love to visit because we live in the most beautiful place in the United States. And that's just the way it's going to be. So anyway, I would take questions. Megan Gould would take questions as well from Rapid Transit. If anyone has questions, go to the podium and ask.
Mayor Nathan Thompson with the Rapid City Journal. Related to the most recent case on Rapid Transit, can we talk a bit about what those sanitizing and disinfecting procedures are that are being done on the vehicles themselves?
So currently with our Rapid Transit buses, Rapid Ride and Dial a Ride, we are making our employees disinfect with a sanitizer as often as they possibly can. They're wearing masks, they're washing hands using hand sanitizer, and cleaning their buses thoroughly at the end of their shifts. With this suspension, we are looking at bringing in a company to go through and completely do a thorough sanitizing process with them, cleaning the upholstery in each bus, wiping down all the handrails, and doing all of that.
Sydney Thorson with Kellow Land. My question is, what do you advise those people who rely on the transit system to do instead of taking the transit system when it's down?
While we are down for these next 2 weeks, we highly recommend them to reach out to anyone that they may know to either bring them groceries, bring them supplies, take them to medical appointments. If that is not the case and they don't have someone, as a community, we need to come together and provide those services for them as well as if we can.
Okay. And then my other question is, if you guys can say, how are those drivers doing? Are they showing symptoms? Are they mild or harsh or anything like that?
As of right now, the drivers are doing okay. I've been keeping in touch with them, and to that extent, that's pretty much what we can provide as far as information. They are doing okay.
Dave Kidd with News Center 1. Do we know if any of the the writers have tested positive for COVID-19 at all? And are we working with the Department of Health at all to track any of that?
We have not heard of any actual writers testing positive or being tested in that sense. The Department of Health has not provided that information, and the writers themselves have not provided that information.
Callie with CODA. I know you guys have a date that it will probably go back to normal, but do you think that could end up being extended depending on what does happen? I know it's a what if, but is that possible?
With COVID-19, everything's kind of unknown to everyone, and at this time, we're going to try to hit that June 15th date. If something happens, there's always that possibility, but for now, that's where we're starting.
Just to follow up on Dave's question related to being contacted by the State Department of Health and if any passengers, have you been able to provide any information about contact tracing to the State Department of Health that would help them in identifying anybody who may have been exposed or any process related to that?
So from what I'm understanding with working with the Department of Health in the last 3 cases that we've been addressing, they are the ones that take it upon themselves to contact the public, and anyone that has come in contact with these drivers and feels like they need to self-quarantine or even have a test done are recommended to contact the Department of Health themselves. So us as a transit agency, we have not done any contact tracing. The Department of Health has been doing that, and I'm not sure what their protocols or requirements or anything like that is.
I would just add that in the last 7 days, Pennington County cases have doubled. And so we're asking Megan what might happen in the next 2 weeks. I think that's really going to be a sight to see. What we've learned about this pandemic is we'll know when we know, and it's so hard to predict. Things change fast. We could find out that in the next 4 or 5 days they've doubled again, in the next 3 days they've doubled. Based on what we know today, Rapid Transit is targeting that June 15th date. We don't expect that to change, but we also don't have the ability to know what lies in the next 2 weeks. One thing I forgot to bring up was the emergency shelter. The emergency shelter is operating. They have people in the shelter, less than a dozen there now. A number of those, less than half or right at half, have tested positive for COVID-19. They are in a special section of that shelter. All of the proper safety measures are being taken. They're being monitored. It is not a Marriott over there. It is a huge conference space that we have fitted to be an emergency shelter, a temporary shelter. So it's serving its purpose right now, and staff, both private and public staff over there, are doing all they can to monitor those symptoms, report to healthcare officials, and do the best, do what's in the best interest of those individuals. So we have seen a variation from day to day on the population over there. It might go up by 2 and down by 3, or it's a little bit erratic right now without a definite pattern, but it is increasing over the last week. So, well, if there are no, oh, Megan has something.
Sorry, just real quick too on the previous question about what the community can do to receive public transportation options while we are suspended. They can reach out to 211, and 211 can provide them with information on different companies or organizations that they can reach out to, like Lyft or Uber or anything like that. Okay.
All right, if there are no further questions, then thank you all for being here, and we'll see you in a week.